Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, doing my COVID update. I have my trusty pug with me who maybe won't snort as much. But anyway, so a couple exciting things tonight to talk about. Let's start with some numbers. Just shy of 250,000 Americans are infected. Just shy there's about 6,000 deaths. In Oklahoma, 879 cases, 34 deaths. Keeping in mind, once again, that I had multiple people call for testing today, either for themselves or a loved one, and there's nowhere to get tests still in Oklahoma. Hopefully that's going to change in the next 3 days, maybe in the next 2 days. But again, our numbers are artificially low since we've failed to provide adequate testing to our citizens here. But, that's just how it is. So figure there's probably 10 times that number or more, maybe 20 times that number, and we're going to start feeling it sooner than later. On a national level, multiple cities are turning into a little bit of a disaster now. New York City today, their EMS service is not going to be bringing in patients who are coding for resuscitation at hospitals. People have heart attacks relatively frequently, and people start CPR, the emergency services get there, they grab the person, rush them to the hospital, and the hospital saves them. Very outstanding care. That's why most metropolitan areas have from call to door of the house, the goal is 4 minutes for these services, because they can have a huge impact if they get there that fast. But that is over in New York City because the medical system is overwhelmed. And that's going to be one of the casualties that, again, people have not understood, that if you saturate hospitals with COVID patients, which is probably going to happen everywhere, it's hard for people with routine, sudden, acute illnesses that normally we can fix to be taken care of. And so that's one of the things all of us in the medical community have been worried about. But it is what it is, and we just have to deal with that. But let's move on to the positives. So I had a call today from Kersey Winfrey. He's a wonderful physician, used to be chief of staff at St. Anthony's. Now he's a VP there, and he's leading their COVID response. And we had communicated several weeks ago and had connected a little bit with some of the other leadership teams at Mercy, Integris, and OU, and he wanted to activate that group today. And so we got that done in 45 minutes. If you read my post, if you haven't, if you did, I'm repeating myself. In just 45 minutes of making a few phone calls, I had all the leadership teams of the biggest hospitals in Oklahoma City drop everything they could do to have a conference call together to strategize for the community, which, I almost could get tearful about it. It's so amazing. And we had a great call, and Dr. Winfrey and Dr. Kruzan and Dr. Reskowski and Dr. Mantor all had great comments. Dr. Chad Smith from Mercy had another call, so he couldn't really participate. And then I talked to him later. And so all the hospitals are completely on board. And I just have to tell you, this is an amazing group of humans. And one of the messages that they suggested we need to get out immediately is shelter in place, and why shelter in place is so important. And I realized that I had not been doing a good enough explanation as to this, and I apologize. We're all human, and I did not explain shelter in place well enough, because sometimes you forget as a doctor that you think you're explaining it well and you're not, and I wasn't. So why is shelter in place important? And it's important because, and why safety in place is stupid and everything else less than shelter in place is dumb, is because we understand the virus. When I'm talking, if I'm virally infected, that virus is coming out and spreading out across the room. It's going to go minimally, 6-8 feet. If I cough, and this is from the Massachusetts Institute of Technology, and I mentioned this study earlier, if I cough or sneeze just a little bit, it travels 22 feet in just a few seconds. So, and once it travels, it can land on things. And so if it lands on metal or wood, it's going to be active for 3 days plus It lands on cardboard or paper 3 to 4 hours at least. And it's aerosolized all over, so as people walk through by me, they can get infected. And so this is the problem. You go to Lowe's, you go to Walmart, you go to Walgreens when you really don't need to, and there's someone there who really does need to go, but you're sick of being in the house, and so that person, not knowing they're infected, coughs. And that may happen 5 times or 10 times a day now at all these different stores, because 3 weeks ago we only had 1,000 people probably infected, or 500, and 2 weeks ago we had 2,000, but now we have somewhere between 10 and 20,000. And so they're all over the place. They just don't know they're infectious or even know they have a cold. It's not like these are mean people, but they're going into stores, they're going into places, they're getting gas, they're doing things, and they're just filled with trillions of viral particles. And so once that person walks into the store and they cough 1 or 2 times, they touch a bunch of stuff here and there, those viral particles are coating the store. So when you walk into that store, you're at risk for exposure and infection. That's how people get infected. And that's why if you're at home and not going out at all, or only when you really, really need to, you limit exposure. And as we limit exposure, we lower the infection rate. And so, as my friend Karl Roszkowski said on the conference call, there is a vaccine. It's called shelter in place. If you shelter in place, you're vaccinating yourself against a virus that is deadly and debilitating and could really hurt you or your loved ones. So sheltering in place is a vaccine. And I think the entire medical community really wants, the dog's being a little loud, really would like all of us to shelter in place as much as possible. Do not go out. Don't have a hairdresser come to your house. Don't do things that require you to go out or expose your family to others. So that is our number one message, I think, from that group today. I think that we're going to have another meeting this weekend, and I think the important thing to know is these really smart and gifted physicians and executives who are completely supporting this effort are going to be planning out how do we do things on a community level, how do we, if we need to open up another area outside of a hospital for patients, how are we going to coordinate taking care of those patients? Let's get ahead of this now while we still have time. I can't rave enough about the leadership teams in all these different facilities who were in relative competition up until a couple months ago, and now they're just completely trying to work together to take care of all of us. And I think it's absolutely positively amazing, and they need to be in our thoughts and prayers, since there are providers at these facilities who have already become infected with COVID, which isn't very well known and of course isn't being emphasized, but our providers, our caregivers, our doctors, nurses, and support staff are getting COVID from taking care of COVID people, even with all the protective gear they have. So they are putting their lives at risk for us. The final thing I'll just say is Dr. Fauci, whose name I know I've mispronounced a million times, but for some reason I just couldn't get his name. I get some feedback that people think I'm being unfair. And I want to be clear. I think he's been great on camera with Trump, but that wasn't his job. His job was, and I want to emphasize, no, I think he's the best part of any news conference if they let him talk. He's clearly smarter than everyone else there and knows what he's doing in that environment. But his job was never to be seen. He has a job that 99% of the time, he's supposed to prevent disease from coming. Having him be all over the place because the disease is here is not a reward for excellence. It's coverage for other issues. And so when people say, he's America's doctor, he's not America's doctor. He was America's infectious disease preventive specialist. He hasn't seen a patient in 35 years. So his job wasn't to be America's doctor. His job was to make us never be sick from an infectious disease from overseas. It would be kind of like having the pilot of the airplane, let's say it was Denzel Washington, walking down the aisle and going, hey, I did not fuel the plane up and we're probably gonna go down, but hey, things change. I didn't check the gas like I was supposed to this time, but oh well. And Denzel's amazing, he would sound great, but ultimately his job isn't to be walking down the aisle and saying the plane's gonna crash. His job was to make sure there was gas in the plane and fly the plane. And that isn't what Dr. Fauci did. I just can't say his name. I don't know why. Because I have a block about him because it's just driving me insane. And again, I think he's a very intelligent and probably a very nice person because, I mean, of course someone's texted me and said, oh, I know him and he's a very nice person. I'm not saying he's not a very nice person. It's just he did not do his job. And that's all I mean by that. And his job was to stop infectious diseases like this from entering our country and making us seem completely unprepared, which we are. So that's all of that. So, but I wish him well, and no one should be threatening him. No one's threatening him like me. It's the right-wingers who think that there isn't a virus, and so they're mad he's saying there is a virus. So thank goodness they've given him some personal protection. It's crazy that people would be mad at him for speaking the truth. So that's unfortunate. So anyway, say prayers for all the providers in Oklahoma, all the providers everywhere, and please, please, please think about the people in New York City and New Jersey, and pretty soon in Florida and New Orleans and Chicago and LA and San Francisco and all these cities where it's just going to be a very difficult run. And let's hope that we can do better here in Oklahoma with our case volume. I'm praying for that. Thank you very much. Good night.